there's a family that brought in their father who's having severe chest pain.
We had a staff person who once brought in their baby really on the brink of arrest.
There was a teenager who had come into the hospital at the Brampton Civic Emergency Department with a stab wound.
Take one day in the emergency department. We have about 80 ambulances that come through our door, and in total, about 320 patients through the door.
If you take an average emergency department in Canada and then you bring it to the next level, that's Brampton Civic.
Brampton is probably the fastest growing city in all of Canada. So the Osler hospitals are the busiest emergency departments in Ontario and often all of Canada. Our hospitals, out of 70 hospitals in all of Ontario, are always in the top 10 in shortest time to see the emergency physician. We needed more doctors, we needed more nurses, we needed more spaces. And all three of those things happened when we had this new emergency department.
Brampton Civic Emerge Department has 30, 40, 45, 50, and I've seen as high as 90 admitted patients any one day waiting for a bed. That speaks volumes to the community that yes, we need a new Emerge department.
When a hospital is built, we get funding from the ministry, but everything that goes inside the hospital comes from donations.
So we're relying on the community to really bring us the state-of-the-art equipment we need to do our daily work. Each and every patient, it makes a difference. So when people are donating to the hospital, they're really donating for all their loved ones and everyone around them. We really ask, as passionately as we can, for them to help support us, to provide the best possible care.
They were able to go home within a few days, and it sounds like the family is doing really well, so I hope they'll have a speedy recovery.
We were able to resuscitate the baby of our own colleague, but to have worked as a team for somebody who we've worked alongside with for years, and their baby, really was very special.
What we did was open up the chest, find the hole in the heart, plug that hole, and within minutes, that teenager's life was saved, and a week later, he walked out of the hospital.
We need your help.
This is our community. These are our families.
Together, we can build the hospital that Brampton deserves.
Your support will save lives. Be a part of this change.